তোমরা এজ এস্টিমেশন করতে পারবে তো? কনফিডেন্ট? গলস্টোন চার্ট, বোনস, ওকে, আর কি আছে? ইনজুরি রিপোর্ট লিখতে পারবে? ল্যাসারেটেড উন্ড কোনটা, ব্রুজ কোনটা, এগুলো চিনতে পারবে তো? বিকজ when the external ask you, we can't help you. External যদি জিজ্ঞেস করে তখন অ্যান্সার করতে হবে। So you should read all those high yield topics, injury part, x-ray part, এগুলো high yield, ঠিক আছে? ওখানে ভুল হয়ে গেলে কিন্তু মারাত্মক ব্যাপার হয়ে যাবে, বেসিক ওগুলো। Fine? So sir has already given you the blueprint of carbolic acid. So we will now follow through, ঠিক আছে? হয়ে গেছে পুরো ক্লাসটা, সব ইম্পর্টেন্ট পয়েন্ট গুলো বলেই দিয়েছেন কি কি দরকার আছে। তো যাও, আমাদের একটা ফর্মাল ক্লাস আছে, ক্লাসটাকে কমপ্লিট করতে হবে। সো নর্মালি কার্বলিক অ্যাসিড ইজ ফাউন্ড ইন পিঙ্ক কালার। নর্মালি পিঙ্ক কালার লিকুইডে পাওয়া যায়, বোতলে দেখবে পাবে পিঙ্ক কালার লিকুইড, ঠিক আছে? পিঙ্ক কালারটা নর্মালি অ্যাড করা থাকে, অ্যাডেড কালার থাকে, বাট ফর সেফটি পারপাস, okay, but in pure form it is colorless prismatic crystals, okay, that we have here. Pure form a prismatic colorless crystals. So when in contact with air, it will turn into pink in color, but that pink is not this pink. That is added pink color, okay, for safety purpose. All right. So position in classification, স্যার যেগুলো বললো ওটা তো ইম্পর্টেন্ট ভাইভা পার্টে, যখন লিখতে হবে, লিখতে গেলে এইভাবেই লিখতে হবে, ইন এ স্পেসিফিক ম্যানার আর অর্ডার, ঠিক আছে? প্রথমে আইডেন্টিফিকেশন, তারপরে পজিশন ইন ক্লাসিফিকেশন, পজিশন ইন ক্লাসিফিকেশন অর্গানিক corrosive অ্যাসিড, তারপরে আসে ফেটাল ডোজ অ্যান্ড ফেটাল পিরিয়ড। ফেটাল ডোজ ইজ অ্যাবাউট 15 গ্রাম and fatal period is about 3 to 4 hours in an average. ডোজ গুলো মনে নাও থাকে, একটা আইডিয়া করে নেবে যে এতটা হতে পারে, ঠিক আছে? nobody will cross you except for super toxic যেগুলো আছে, যেমন অ্যাব্রিন, ওই রাতি সিডস, ঠিক আছে? সেখানে তোমরা যদি অনেক বেশি বলে ফেলো, then the examiner will cross you. So ওখানে যেমন 1 seed 1 to 2 seeds are fatal, তো ওখানে যদি কেউ বলে আমার 10টা সিড ফেটাল হয়ে গেল, so it's very difficult to come through that. Okay, next is the mode of action. Okay, ki kore kaj kore? So it acts both and as in local effects as well as systemic effect. Okay, locally and systemically. Locally ki korbe? As usual, corrosive, it will corrode. Okay, and remotely it possesses the narcotic effect. So first of all, one has to know what is protoplasmic poison. Protoplasmic poison, name a poison that has protoplasmic effect. So you should say carbolic acid. Okay, so what is that? What property does it have? It coagulates the proteins. Okay, it coagulates the proteins, and it doesn't combine. Normally ki hoy, acids, they keep on corroding and they stabilize themselves by adhering to the tissues, but in this case there is no adheration, so the absorption power means it will penetrate more deeply in the tissues. Okay, that is one of the features. Others are like it will cause extensive capillary damage, as well as there will be clotting in peripheral vessels. Fine. So as sir said, if the poison means carbolic acid drops in your skin, what will happen? In intact skin, there will be corrosion. So what was that? White colored HR formation. White colored HR formation. Okay. So picture is not available with us. You can find it in online. There also rarely the pictures are available, but still one should know the most characteristic features. If it falls on skin, in intact skin, it will form white HR. which after few days it gets removed, falls off, then there will be a staining of the tissues which will stay for a long time. So what is that color? Brownish stain. Okay, there will be brownish stain after falling off the HR. Fine. So next we come to medical legal aspects. As sir already discussed, that it is normally suicidal. All corrosives are suicidal normally. Homicidal very rare, because it is very difficult to commit homicide through it. Okay. So suicidal, why is it common? Because it is easily available. Fine. And commercial use, you have to, it's very easy to remember. It's used as a disinfectant, fertilizers in manufacturing of explosives, all those things. Very easy to remember. Okay. Accidental jokoni ashbe, you should remember of children. So children can consume it accidentally, thinking of it is as a some liquid or something. Cold drink bottle thakle cold drink bebe খেয়ে নিতে পারে, ঠিক আছে? So one should be very careful while keeping this poisons at home in bottles. It should be properly labeled. Now coming to signs and symptoms. Very important, signs and symptoms. ওই দুটো ছবি দেখছো এতেই পুরোটা কভার হয়ে যায়. First of all, it causes the pupils will cause constriction of pupils. Another thing is greenish color urine. What? Mydriasis. No, this is constriction of pupil. Meiosis. Alright. So all poisons normally causes dilatation of pupils, except few poisons like cocaine and carbolic acid, opioids. Okay. And these greenish color urine, এটা কি ছিল CA exam এ? Greenish color urine ছিল না. So that was removed. Previously it was. So greenish color urine. Okay. So normally in carbolic acid poisoning, there will be the color of urine will be colorless, means normal color hi hobe, ঠিক আছে? But it will be scanty, মানে কম হবে, oliguria হবে, ঠিক আছে? Scanty urination. But still, if the urine passes, when it comes in contact with air, it will form greenish color. So that is the color what is shown over here, greenish color urine. Okay. So why is this? There is olive green color. It is due to oxidation of hydroquinone and pyrocatechol. Okay, which are oxidative products of phenol. Fine. All right. And the gastric lavage part, sir has already discussed. That is due to its anesthetic property, the insertion of the tube will cause perforation. Okay, that's very important. Every examiner will ask you that part in carbolic acid. Very important. So treatment as sir said, first you neutralize the poison by water. ঠিক আছে? So normally what sir told, we can give normal water, but in certain books it is given that we should use max sulf or sodium sulf in 50-50 ratio, 1:1 ratio in 500 ml of water, which has to be passed through the stomach tube, which will form what? Sulfocarbonates. Okay, and that will be eliminated harmlessly. Sulfocarbonates. Max sulf and sodium sulf combines with carbolic acid to form sulfocarbonates. Okay, that will be passed away. So it could be a antidote. Fine. So, can you make such noise in exam? So, there will be less help as you all know everything. I will speak less, you will speak more. The same should continue in exam also. We will be keeping quiet, we will mute ourselves and you will be talking. And then we will see who talks more in exam. External will be there, we will provide no help. As you know all everything. So please keep quiet and try to listen. Okay. So demulcent drinks. You should know the term what does the demulcent means. Demulcent kaderke bola hoy jante hobe. Milk. So what is the property of demulcents? Neutralize. It forms a gastric barrier. Okay. Gastric barrier. In order to save the gastric mucosa. Then we can provide activated charcoal. Rest all are for every means same for every other poisons. Symptomatic treatment, correction of fluids to avoid shock. Okay. If in case it falls in skin, intact skin, we should wash it off. All those normal things. So important findings, PM findings, sir has already told. It will have leathery appearance of the stomach. Leather-like appearance of stomach. Corroded, it will be corroded. Okay. Dark brown in color. Fine. The stomach will be ashy gray or brownish. Okay. And it will be leathery in appearance. Okay. That is very important. Leathery. Fine. Kidneys, there will be renal failure. Those are the features of renal failure. Dusky medulla, pale cortex. These are features of renal failure. Fine. So, this concludes carbolic acid. Now we'll shift to forensic psychiatry. Okay. Remaining very important part. Forensic psychiatry, we have left our very important points and topics. So, we have discussed earlier in lecture till the delusion, hallucination, all those things. But there is something called, Mental Health Act. So that was not discussed. Okay, Mental Health Act. Then how we admit the patients in psychiatric hospital. যাকে তাকে তো ঢুকিয়ে হসপিটাল অ্যাডমিট করা যায় না, কিছু নিয়ম কানুন আছে, তাই তো? So we should be knowing all those things. And there are some criminal responsibility. There is a particular topic about criminal responsibility. Okay, criminal responsibility কোর্টে কিভাবে ওটা জাজ করে. So there are certain rules like McNaughton's rule, Durham's rule, Curren's rule. Okay, so depending or basing on those things, those rule, the judgment is been provided to insane, means whether insane or whether not sane or not sane. Okay, whether they are responsible for their crimes or not. So normally the convicts try to frame themselves as insane person to avoid punishment. Okay, so in those cases, this Durham's rule, Curren's rule, and all this McNaughton's rule, the court takes into consideration according to them by their definition and all, and they provide judgment. So we should know each of them, because questions will come like this. Differentiate between McNaughton's rule and Curren's rule, and what is the difference between them? Okay, মানে কি difference আছে ওতে, and which is better. So that is criminal responsibility. First of all, we'll start with this because we left till here. in the lecture class. So we have 15 minutes left. So I'll try to explain as much as possible in a very short and gist manner. You can read that at home. I will give you the basic guidelines how what to be read. Books se to sab kichhui ache. Okay, but what to read and all I will just say in 15 minutes. Okay, খুব ছোট topic আছে, খুব একটা বড় না. So first of all, hypnotism. So hypnotism, এটার main important কি আমাদের লাগবে? So if a subject says that I was hypnotized and then I committed a crime, okay, if he কেউ আমাকে hypnotize করেছিল দিয়ে সে বলেছে বলে আমি আমার সেই জন্য আমি ক্রাইমটা হয়েছে, so that is not acceptable to law, okay, because সে ইচ্ছাকৃতভাবে hypnotize হতে গেছে. Okay, so hypnotism will not, hypnotized patient মানে এই clause-টা will not help in not help in providing innocence in court. Okay, generally not accepted in law. Last line is important. আর বাকি সবাই জানে hypnotism কি জিনিস, সেজন্য অত explanation করার দরকার নেই. So diagnosis of insanity. Diagnosis of insanity মানে who is sane and who is insane. Please keep quiet. Very important. It's very important topic. Who is sane and who is insane? আগে মানুষদেরকে sane insane ভাবে বলা হতো না, lunatic বলা হতো. So better term is now it's used is insane person, sane insane, or mentally ill. Okay, it's taken as a disease. Okay. So diagnosis of insanity should not be given in a single session. মানে আজকে পেশেন্ট এলো দিয়ে বললো আমার এই হচ্ছে and you just don't put a diagnosis on the paper. You have to observe the patient for months. Okay, how many 10 to 30 you have to observe the patient for months, মানে অনেকগুলো সেশন হতে হবে, then you come to the conclusion whether he is mentally ill or not. Fine. So at least 3. Book says 3, but in practically the psychiatrist they give date and date and date. At least they observe for 6 months or more. Okay, then only they put a diagnosis on paper. And first they will take history and all, then all those whatever it is, then they will put the patient under observation, and after that only they give a diagnosis. না হলে কি হবে, কালকে বলবে আমি পাগল ছিলাম, আমি ইচ্ছাকৃতভাবে কাজটা করিনি, আমি পাগল, I am insane person, that's why. Okay, so you should know about insanity and false insanity. So the means criminals try to mimic themselves as insane person, so one should be knowing how to differentiate between sane and insane person. That is in this table. In other books also you will be having, so go through it. Okay, very easy, not so difficult. Management of property for insane, that is also important. Okay, so insane person, can he sell, buy property? No. Okay, so those things you should you may have to write in the exam. What is the responsibilities of a insane person and how he will maintain. এরকমের যদি question আসে, then you have to mention all these things. Okay, they cannot go in contracts. Any contract, if an insane person goes in, will not be valid in court. Fine, but there is a twist. If the other party যদি বলতে পারে that the person was in lucid interval, then it will be valid. Okay, so the term lucid interval is very important again. So দুটো ইনসেন নের ভেতরে যে মাঝে একটা পিরিয়ড যেখানে person is sane, that is lucid interval. So lucid interval again is a very important term that one should know. What is lucid interval? Exam e asbe. Marriage, so they cannot enter in a contract of marriage in insanity. Okay, insane person cannot be in contract of marriage, and if it was if jodi what do you call what do you forcibly kimba ছলের এতে যদি ম্যারেজ হয়ে থাকে, that will be null and void, it will get dissolved. Okay, witness, they cannot bear witness. Okay, they cannot bear witness, but still if the subject is in lucid interval, they can give witness. Okay, lucid interval. এবার প্রবলেম হচ্ছে যে কে বলতে পারবে যে ও lucid interval এ আছে, so it's very difficult. So normally it is not taken, but still lucid interval এ থাকলে it will be valid. So this is about lucid interval, but we don't have much time to talk about it. Anyway, MLI is responsible for all civil and criminal acts. That is the most important line. MLI of lucid interval. Consent and insanity. See here the definition. If person who due to unsoundness of mind unable to understand the nature and consequences of the act. A unsoundness of mind. This term will come in all this rule. McNaughton's rule আসবে, Curren's rule আসবে, Durham আসবে. So we will see very মানে তাড়াতাড়ি এগুলো দেখে নেব. টেস্টামেন্টারি ক্যাপাসিটি, ওই টেস্টামেন্ট দিতে পারবে না, এগুলো সব holographic will একটা কোশ্চেন আসে, holographic will টার্ম এটা শুনতে খুব ডিফিকাল্ট লাগবে, বাট নাথিং, ইটস জাস্ট রিটেন উইল। নিজের হাতে লেখা উইলটাকে holographic will বলা হয়। The will written by the person himself in his own handwriting, that is known as holographic will. Okay, eligibility for making will. So normally while a person makes a will, the doctor has to sign. Witness to দুজন থাকবে, and there will be a doctor who will be signing, so that signifies that the person was in sound mind. Okay, another thing, inheritance of property cannot be disqualified from inheritance of property. That's also important. Property পেতে পারে, এটা কোনো ডিসকোয়ালিফাই হবে না যে আমি পাগল বলে সে প্রপার্টি পাবে না। That's okay. Okay, here it comes. So normally the court presumes that all people are sane until and proved otherwise. ঠিক আছে? So any subject when brought for trial, he will be considered as a normal person and the trial will continue. But the onus lies on the subject to prove himself that he is insane. Okay, বোঝা গেল? Very important thing. So mens rea and actus rea one should know. Mens rea মানে guilty mind. Okay, and actus rea means action, guilty action. Okay, so this will be asked again. What is actus rea, mens rea? This is what test for determining criminal responsibility. Criminal responsibility এই যে এবার আসবে। McNaughton's rule, right or wrong rule, very important. The examiner will, if the examiner wants to ask a question in forensic psychiatry, this is the number one question to ask, that what is McNaughton's rule. So you should remember the definition. Okay, an accused person is not legally responsible for his actions at the time of committing the crime he was suffering from such a defect reason from the abnormality of mind that he did not know the nature and quality of the act he was doing, or that what he was doing was wrong. Okay, what the definition means is, যে সময় যে একটা করছিল সে যদি নিজের একটা বুঝতে না পারে যে ওটা ভুল না ঠিক, ডিউ টু দি আনসাউন্ডনেস অফ মাইন্ড। ওকে, দিয়ে এইটার বেসিসেই খালি কিছুটা মডিফিকেশন হবে, Curren से Durham है. Okay. Thing will remain same. Only few words will be added. Okay. One, there will be product. Wait, I'll come. Okay, Daniel McNaughton हमें दो लाइन बोले दी. Daniel McNaughton in 1843 was accused of murdering Mr. Drummond. Okay, and later on he was tried in court. He was found to be having delusion of persecution disorder, and later on he was means not put on what do you call not put on keyboard ওদের তো কি ছিল electric chair না যা কিছু একটা ছিল, so he was not punished, he was not executed, he was not punished, he was put in asylum. Okay, mental asylum. So that was very famous case, delusion of persecution. Okay, we don't have much time for all this. So section 84 of IPC, now it has been changed, but yes, 22 BNS, but the lines are the same. Okay, only the BNS has changed. IPC has changed to BNS. So what it states, nothing is an offense which is done by a person who at the time, same thing, who at the time while doing it by reason of unsoundness of mind is incapable of knowing the nature of the act, or that he is doing what is either wrong or contrary to the law. ठीक है? So it is same as McNaughton's rule. Only few lines have been added. So in this lecture, I have put a few points regarding what are the flaws of McNaughton's rule and all. That I will give you the lecture. You can go through it because we don't have time. We have 2 minutes left. Durham's, Curren's. Okay. See here, the term here is product of mental disease or mental defect. This is the only important part. Product of mental disease or mental defect. That has been added in Durham's law. What we say? This is Curren's law or rule. This also you should remember. Okay. Doctrine of diminished responsibility means in few courts they say that, means they give verdict that both were responsible, means so pagal hole he is slightly responsible for his crime, but in India we follow all or none rule. Either he is pagal or either he is yes. Okay, all or none law. So Mental Health Act. So this part is important. Admission in psychiatric hospital. So one should know that there are procedures following admission in psychiatric hospital. The patient may voluntarily get admitted. Okay. So admitting in psychiatric hospital is known as reception. Okay, reception order. Ete reception order lage. ठीक है? So one can voluntarily be admitted. One can be admitted if in reference of their relatives. রিলেটিভসরা বিরক্ত হয়ে বললো যে আমার বাড়িতে একটা পাগল আছে, আপনারা এটাকে ভর্তি করে নিন। And another way is by court. Okay, the court will ask that the subject to be the court will provide the reception order. Okay, court decide করবে যে ওকে রাখা হবে কিনা, মানে অ্যাসাইলাম মানে মেন্টাল হসপিটালে পাঠানো হবে কিনা। Then comes admission, same there is discharge. Okay, discharge in the discharge এতেও কিছু laws আছে. So normally 2 doctors are needed for providing discharge. Okay, and if the subject states that I am not insane, and the means people and the doctors think that he is insane. Okay, পেশেন্ট বলছে আমি পাগল না, কিন্তু বাড়ির লোক কোর্ট সবাই বলছে পাগল। So then in that scenario the patient can be kept in hospital. Hospital মানে admit করা থাকবে, okay, in mental hospital up to how many days? 30 days or 60 days? 30 days in case by the doctors, but if court 60. Okay, all these things you have to go through. কোথায় কত দিন, okay? Reception order and all you have to, I will give you the lecture, you go through it because it will take time to explain all this.